I think it's very important when people are considering which surgeon they want to go to. First of all, we have several good surgeons. We don't have a lot. We're few and far between. There are only 4 or 5 of us in North America that do this surgery. And there are even fewer of us, very small number, only 2 or 3 of us that can do all the procedures that a trans person could want. Facial surgery, chest surgery, and bottom surgery, female to male, male to female. Only 2 or 3 of us. And I think those 3 or 4 of us that do this surgery, I think they're all pretty good, really. They're pretty good. And to me, it's important to go to someone who you feel comfortable with, who you know is fully trained, who can do the whole realm of surgery. If there's someone you know who's had a good experience with that person and they're happy, then that's a reason to go. It's not a bad idea to get maybe a couple of consultations, maybe with a couple different people before you decide if you can. But you have to feel comfortable with a person. They should be fully trained. They should feel comfortable doing whatever you need, and you should feel comfortable with them, even if they have good credentials. That's an important thing, to just be comfortable with someone. I think there are very good reasons to stay in the United States. You can have the best surgery in the world, and there are some surgeons in Mexico or Thailand or Canada who can do good surgery. There may be others in those countries that don't do good surgery. And when you come home, even if the surgery was done perfectly, and even if you're perfectly healthy, it's still possible to have a complication. I tell my patients that all the time. And I think I'm a pretty good surgeon, and I'm very experienced, and I have very good results. But I tell everybody, even if I do perfect surgery, even if you're perfectly healthy, it's still possible to have a problem. Well, you know what? It's good to be not too far away from your surgeon if you have a problem. Because you can come home from Thailand or Mexico or Canada and have a problem, and it's not so easy to get on the next plane to Thailand. It's expensive and it's time consuming, and you may need to see someone soon. If you're bleeding, if you can't urinate properly, if you have pain, if you have an infection, you need to see a surgeon soon. Even if it's cheaper in another country, there are reasons why it's cheaper. In some countries, very little is paid attention to requirements for surgery. There are places around the world where they'll do surgery for the money. And they don't really care about what happens to you afterward. They don't care about the fact that you're a good or not a good candidate for the surgery. In the United States, and it's actually an international organization, the WPATH organization, that stands for World Professional Association for Transgender Health. It used to be called the Harry Benjamin Society, after Harry Benjamin, an endocrinologist in New York, who was one of the first doctors in the United States to treat trans people. Most of the United States surgeons that I know, those 4 or 5 of us that are the main trans surgeons in the United States, we follow pretty closely those WPATH recommendations. The organization years ago created a document called the Standards of Care. It's just a document where they make recommendations on the treatment of trans people, and also what prerequisites someone should have before they have surgery, especially the bottom surgery. I'm not so worried about the facial surgery or the chest surgery, because that's sort of reversible. And at least for my own self, I never do anything so radical that they don't look good as a male or a woman. You know, if we change a male's face to a female's face, more feminine, they can still be a good-looking male, but just with more refined features. And even the chest surgery, if we remove a breast, we can always put implants in and rebuild it. Or if we put implants in, we can always just take the implants out. So those procedures are either reversible or they're acceptable. But the bottom surgery is very difficult to reverse, so it's really good to know that this is the right procedure for you. Because once you do the surgery, you can never go back to exactly what you had before. The anatomy is really permanently changed. It's important that surgeons follow these standards of care. In many countries, they don't. You go there with your money in hand, they'll do the surgery, they'll treat you as nicely as they can, and you'll come back and hopefully you won't be sorry you did it. I think it's really important. That's another reason to stay close to home. Or be sure you go with people that are very experienced and have a good track record. I think that's very important.